constantly evolving.
In this week's Bondi Vet compilation, hold on to your lunches as we present the most stomach-churning,
It's just crunching under my fingers.
the most challenging,
We need to get this calf out now. If we don't do this quickly, calf's not going to make it.
and the most squeamish cases in the history of Bondi Vet.
I'm sorry, sweetie, but that was horrid.
Can you make it through without turning away?
The mother of all challenges.
Now, I don't treat too many donkeys in Richmond, but I'm always up for a challenge.
The patient resides at a sanctuary that looks after abandoned donkeys.
Hello, Derek.
Hello, Scott. How are you? Welcome to the Isle of Wight.
Welcoming Scott is the sanctuary's manager, Derek.
We've got 93 donkeys.
Wow.
They lead a fantastic life. These donkeys are part of the heritage of this island. They pulled the milk floats, they worked the beaches of Shanklin and Sandown and Ryde. These donkeys didn't ask to be made homeless, they didn't ask to be abandoned, and we're determined that they'll have a proper home here because without us feeding them and looking after them, they have nothing.
Well, they seem very happy
Yeah,
and very healthy, but I hear that you've actually got a donkey that's not too healthy. Is that right?
There's a donkey we'd like you to see today called Poppy.
Okay.
She's one of our most popular donkeys.
Right.
She's been struggling with a clogging up of her sinuses, causing her a lot of discomfort, and we just simply can't unblock her nose. And so it's been a tough few weeks for her.
Oh, you are nice. Like you a lot. Yes, even with your gunky nose. Hey?
Farm manager Julia has been looking after Poppy, but the donkey's deteriorating condition has now forced her to choose more invasive treatment.
So how long has she had a snotty nose for?
Couple of weeks. We've noticed there was a little bit of discharge, so we used to clean her nose, but then the discharge didn't stop. It was more and more and more.
Poppy is suffering with something called sinusitis, which is an inflammatory condition of the nasal passages. It can be caused by a number of different things, anything from just a pure infection or as a result of something more sinister like cancer.
OK, let me introduce you to our vet.
Always willing to expand his expertise, Scott will be learning some new veterinary tricks from equine vets Kate and Lara as they try to unblock Poppy's nose.
We've brought the X-ray along to show you. I think it gives you a really good visual idea of what's going on. And you can see we've got the white line across here, which is fluid and pus accumulating underneath.
So that's a pool of snot, basically.
Pretty much snot, pus, general mankiness that we need to get out. So what we're going to be doing today is drilling into that sinus and releasing all that gunk, flushing it all out and making her feel a lot better.
So we're actually going to drill a hole into Poppy's head.
We're actually going to drill a hole into Poppy's head.
Oh, my goodness. She is going to have a hole drilled into her nose, but she's not going to be knocked out fully, which just shows how resilient and how tough these beautiful creatures really are.
Ready for this?
Ready as I'll ever be, yeah.
OK.
All right, I'm ready for it.
Just go with the flow, yeah.
Yeah, so just if you guys tell me if you're happy with the positioning.
Pushing this drill into Poppy's head, it's quite a frightening experience because you think, you know, how far is this going to go?
It will take a little while, so it's not an instantaneous thing.
Procedures on farm animals are often done under local anaesthetic to avoid the risk of a general anaesthetic and the stress of moving them from their normal environment to a hospital.
That's the hardest bit, is getting started.
Oh, Poppy, my God.
He'll feel it as it goes through. You almost get a pop and you get a relief of the pressure as you're pushing on it. So he'll suddenly dive in and then he'll be through into the sinus.
OK, she's going back.
OK.
Oh, my God.
There you go.
Right.
Jesus, that was gross. Oh, my God, that was revolting.
I'm sorry, sweetie, but that was horrid.
Does it feel like it's free?
Finally, I pop through and it's quite a sickening feeling, but now we can have good access into the nasal cavity and see what's causing that infection for Poppy. It's amazing. So I'm just using the endoscope and I can see normal, healthy mucosa, which is sort of the membrane covering the nasal cavity, and then a bit of a pool of gross stuff. We haven't found any tumours or anything nasty, so hopefully it's a really good result for Poppy. It does seem like this is a fairly classic sinusitis, and with good flushing over the next week and antibiotics, Poppy should make a full recovery.
Good girly puppet.
A draining tube will stay in place for a few days to make sure the sinuses are totally cleared.
Despite the fact that she's now got a hole in her head, she's probably thinking, yeah, this is a good day.
Wow. Well, she's had some bad days, clearly.
You okay? Yeah, you're lovely. Well, you know, you probably looked nicer, but yeah. Yeah.
At the Isle of Wight, Poppy's recovering well from invasive surgery to clean out her infected sinuses.
Good girl, hey? Hey? Yeah, good girl. Nasty surgery didn't ruin your appetite, did it? Good girl, and you don't have a snotty nostril anymore. Wow.
I'm just so amazed at how strong and brave and stoic these creatures are. I've drilled a hole into this poor girl's face, and she's still nuzzling up to me, giving me kisses. She must be feeling better.
Good girl. Come on, then. Let's get you in. In we go. Come on, then. Let's go see
look who
what
it is.
She is.
Poppy.
There we go. Hello, Poppy.
And now Poppy is up to having visitors. Sanctuary manager Derek has dropped in with one of her best mates.
How are you?
And everybody looks very concerned over the wall, I can see.
Yes. Yeah, there's been quite the audience today. I've felt under pressure, but hopefully I've delivered.
Brilliant.
I'm very lucky to come here to work with these incredible vets and to see Derek and all the great work that he's doing here. These animals need these people, and together it's a beautiful relationship. They're beautiful animals, and they're really lucky to have a wonderful place to live. Thanks for having me, and I hope that Poppy makes a full recovery.
That's great.
Thanks, Derek. You look after that girl for me. Bye, Poppy.
Hey, how you going?
Oh, you're new, aren't you?
I am, yeah, I'm Chris.
Oh, right, Chris.
G'day, Chris.
Now, where is she?
Down in the yard here.
How long has she been straining for, do you know?
Oh, she was a bit uneasy in the middle of last night, and we brought her in about 6 this morning.
Rob and Bev are worried because Lara is having her first calf, but it's not going as planned. She's in all sorts of trouble. So you haven't seen any feet behind there or anything?
No, I just had a feel, and there's a foot there, and I think it's maybe back feet.
Okay. With the breech birth, essentially, a calf is going the wrong way down a one-way street. So that means the biggest part of that calf's body, its hips, are the first thing that has to be pushed out. That makes it really tricky.
There's a bit of a feel in here now, just to get an idea about what we're dealing with.
Go. Won't be long.
It's back feet.
It's hard enough having your calf the first time naturally, but when the calf comes out backwards, she's just got the mother of all challenges. Unfortunately, there's no way of actually switching the calf around and make it come out the right way, so we have to deal with what we've got. And the way we do that is attach some chains around the ankles of those back legs, and then apply some gentle pressure and just hope the calf comes out. It's a really difficult thing to do. It's sort of like trying to tie a knot in a bit of spaghetti. Now I've got chains around both legs and feel both feet. They're both straight. We're ready to go. Okay, yeah, give that a bit of tension there.
After 30 minutes of hard work for everybody, finally the first signs of the calf.
Oh, well, we've got a foot there now, we can see.
Yeah, we're making progress. See, that's the sole
Oh,
of it.
yeah. Oh, yeah, it's upside down.
There we go, just go. Come on, Lara, it's all right. Here we go.
This is about the toughest one we've had for a long time.
We've got legs out and the hips are just starting to come through Mum's pelvis. From now on in, things are going to happen really quickly.
Lara collapses, putting her life and her unborn calves in extreme danger.
The size of the calf is just pressing up on her nerves around her legs, and she just can't support her own weight when those pressure on those nerves is so great.
We need to get this calf out now. If we don't do this quickly, the calf's not going to make it.
Sorry, girls, it's the hardest part. Come on, Lara. Get through this, girl. You'll be right.
The calf is out, but there are no signs of life.
Just trying to drain the fluid out. Come on, after all that, I'm going to give your mum a nice surprise, huh? Who's been through a lot for you.
He's still alive.
Still alive.
I'm really glad I called you. We would have had a dead calf otherwise.
Yeah. He's a big boy.
Girl.
It's a girl. You're a big girl. You surprised me.
Oh, you're a lucky girl, I think.
Yeah.
I think you're a lucky girl. Good on you, Chris. Beautiful little calf.
Well, there are rules in this world, and you were meant to come out the other way. You broke the rules. It's okay. You made it hard for everyone, especially your mum.
Very grateful, Chris.
Yeah.
That's all right.
Yep.
Any ideas on names for her?
Well, what do you reckon, Bev?
Well, what about Christina?
Christina, oh, Chris the vet, yeah.
Yeah, that'd be, we'll remember all this then.
Yeah.
Christina. Going to break the news to Mum and Dad that there's a new member of the family. I'm one of 3 boys, but now there's a girl, Christina Brown. That would be some sort of shock.
Come on, girlie.
Yeah, that's better than I thought
It's
it
over
would
here.
be.
Straight away, Lara walks over to Christina, starts licking her and making those little mooing sounds which just say, hey, I'm your mum. I'm here to help you. It's a really nice moment.
Been a good outcome.
Yeah,
Yep.
great.
Really good.
Thanks so much.
Oh, he's done extremely well, I'd say, yes. A lot of city vets are small animal vets, and this is probably a challenge for them too.
So far, so good. First task achieved. Both animals alive, seemingly happy. It's good. I think it's only going to get tougher though.
The little heifer has now recovered from her difficult start to life and is now a picture of health over at Rob and Bev's farm.
What do you reckon, Bev? As good as we've got?
Yeah, Christina. Good little calf.
Really good.
We're very grateful to Chris for, bringing Christina into the world, and she's such a lovely little thing.
I think she's got some head fractures, so we'll just get her out and make sure she's breathing okay.
At the Bondi Referral Hospital SASH, 5-year-old Betty has arrived with shocking head injuries after being run over.
Goodness me. That's definitely a broken jaw. It's just crunching under my fingers. This just looks absolutely horrendous. I mean, this little cat's skull has been crushed by a car. I think she's got broken jaw. I think there appears to be fractures possibly around her eye as well. Her whole head has basically been squashed.
Owners Linda and Max are heartbroken.
We couldn't have children. She's the daughter I never had.
Brain injury and vision loss are the major concerns.
So we have to really look at those injuries that she's got to her skull, and also have a look at if she's got any injuries in her chest, because if her head's gone right under the car, it's possible that her chest has been squashed as well.
Betty urgently needs full head and body scans.
She's our baby, so go ahead.
Okay.
Whatever it takes.
All right, puppy, let's see if we can do this scan. If you think of the size of a cat's head and the size of a car, and the car going over the cat's head, squashing her face, her brain has got to have had a bump in there as well. So whether it's just a mild concussion or some more serious brain injury, only time's going to tell. There's the jaw fracture. Just there, you can see her lower jaw has basically been split in two. The two sides of her jaw are basically working independently of each other and just hanging there in space. It's got to hurt.
Hey, sweetie.
Incredibly, Betty's chest and other internal organs have not been damaged, but the much-loved pet is just hanging on.
Hello, princess.
Linda's bond with Betty is really special because Linda's actually had health issues herself, and Betty's the one who sat on the bed with her and helped her through her problems.
Betty looks after wife, if wife's a bit crook sort of thing. They seem to understand each other. If Betty's a little bit off colour, Betty goes to wife and vice versa.
This is a tough situation for everyone. Betty is a mess. She's got a fractured jaw, she's in shock, and we can't give her an anaesthetic now because if we do, we could kill her. This is just one of those horrible catch-22s.
Fingers and toes. Please cross your fingers and toes too. And now we've just got to wait and hope.
I don't know how long we can leave.
Yeah, I know. It's getting to a point where we've got to, if she's stable enough, take a calculated risk so we can get this side of it done.
Surgery on Betty's shattered jaw has been scheduled today with specialist Andrew Marchevsky, but in the past 24 hours, Betty's condition has suddenly deteriorated.
You know, she became so anemic so quickly. I think if we'd have operated when she first came in, you know, she'd have died on the table. Yeah. No, darling, we need to get you sorted, don't we? The trauma case is always a balancing act. There's never a perfect time to do a surgery. You've just got to be a time that's the best given the situation.
Oh, good kitty.
That is your plan. You need to work towards
I have to make it look
this
like that
face.
again.
Now that you're a qualified cosmetic surgeon
Right.
for cats.
Yeah, I'll make it look better than that. So we're just going to, first of all, stabilise the jaw so it's nice and solid. Get her occlusion, so alignment of her teeth right. And then once we've done that, we can then suture all the skin back onto her mouth. So it's a bit nasty. You can make a jaw heal any way you like, but it's very unforgiving. It's got to be pretty perfect. So you can see that tooth there is fitting in nicely just in that right spot there. Yeah, I do a pretty good job. She still probably has some potential brain injury there. So hopefully now we've got a facial trauma controlled as much as possible with this surgery. We'll be able to really see what her brain's doing.
Betty! Betty, Betty! Are you
Brave Betty has made it through the surgery to reconstruct her shattered jaw.
Come out. Hop out. Come on. Good girl. Look at you. Oh, my goodness. Practically jumping out. Hey? Her jaw's healed nicely. She can see, and most importantly, she doesn't appear to have any brain damage, which is just fantastic.
Hey. Oh, my darling girl.
Hello.
Look, you've even got you.
For Linda and Max, the ordeal is finally over.
Oh, trying to get away. Yeah, she's back to normal. Yes. There's been a bit of a brain transplant because she's actually quite nice now rather than aloof, so that might change. She might go back to normal.
She just won't be allowed outside. Are we listening, Max?
Right. Yeah. Yeah, no, that's right. Yeah.
Scott's now taking a break from his London practices and heading west to Wales to polish up his skills as a farm vet. Scott's being put straight to work after a call about an emergency at a local dairy farm.
A Jersey cattle owner has called to say that one of her girls is very sick. All we know is that this poor girl isn't eating and she does have a calf.
Scott will be working under the guidance of vet Vicky.
Right, time to get suited up.
Yep.
She deals with big farm animals on a daily basis.
What we need?
But Scott hasn't done any major procedures on a cow since his university days.
Oh, my goodness. Here we go.
Waiting anxiously is dairy farmer Helen. She's worried about her much-loved cow Athena, who's recently become a new mum.
She just looks generally miserable and not happy with life. We never have problems with calvings of the Jerseys, so I'm a little bit nervous.
Hi, I'm Scott. How are
Hi,
you?
I'm Helen. How are
Hi,
you?
Helen. And who's this gorgeous beast?
This is Athena.
Athena. Very beautiful. Right, so what are the issues that you've been having with your cow?
She's been calved just under a week, and we've noticed the last few days that she hasn't really been eating as much as I'd like her to. She just looked a little bit depressed.
Right. First thing, let's have a little listen to her heart. That's all clear. So I'll just listen to her stomach. Oh, do you want to have a listen?
There's not a huge amount of noise going on in
it's
there.
quite quiet.
Yeah.
The rumen's not moving.
Yeah. So it's just not functioning at the moment. Yeah.
All I can hear is complete silence, and that's a real concern. The 4 stomachs inside a cow should make a lot of noise, and when they don't, that's a worry. I believe that this cow might be suffering with a condition known as left displacement of the abomasum, or LDA. It's basically where one of the 4 stomachs is twisted and can commonly happen after a cow has had a calf. The way that LDA is diagnosed is by using percussion, so basically tapping on the side of the abdomen of the cow.
You hear it?
Oh, wow, yeah, there.
There.
Oh, yeah. Wow, that's amazing. That is a lot different to the surrounding area. It's very distinctive sound, isn't it?
Yep.
We can hear a very tinny sound, which basically sounds like a bag, which is the abomasum, filled with gas. So it sounds a little bit like a drum. So pretty much part of the stomach that's here needs to go over there.
Yeah.
And the only way to do that is by reaching in,
Pulling it back.
pulling it out. Athena at the moment's uncomfortable and she isn't eating and she will lose weight quickly, so we need to intervene with this surgery.
First, Scott and Vicky need to release the trapped gas before moving the stomach back into place.
Good to go?
Yep.
The procedure will be performed through an incision made in Athena's side.
So I'm always nervous when surgery's involved in any animal. We haven't had a huge amount of them done here either, so from an owner's point of view, it's a little bit nervous to watch it happen, yeah.
I can just feel across. I can feel a nice big stomach on the other side.
Right.
So now we're going to deflate the stomach.
So this is quite a dangerous moment, really, isn't it, Vicky?
Yeah, this is quite a big needle, and idea is we want to just take the needle across, put it straight into the abomasum and get the air out.
Back in my uni days, we learnt about farm animal stuff, but it's about 20 years ago, so I do need to refresh my skills with these fantastic farm animal vets.
So if you're going to stab anything, stab yourself.
Right.
So you want to take that,
Yeah. So
guard it.
I just want to keep that on there and guard it with my life.
Yeah.
All right, Athena, you can trust me, sweetie.
So round the intestines.
Oh, my goodness, that is actually quite hard to do.
Yeah.
Without stabbing yourself.
Yeah. So once we open up the cow, you're going in blind. It's just experience and knowing what's normal and navigating under and round, quite important bits of anatomy.
And then?
Just straight in.
Straight in?
As far as you can.
Okay,
And then
it's going in now.
there we are. So the gas that comes out, that's basically fermented grass. That's what they're eating at the moment. And it's sat there for a good couple of days, so it's quite rancid kind of smell, really.
My heart is actually going, doing that. So that's frightening, is performing a procedure like that, a massively sharp needle around this poor girl's organs.
Protect the needle, bring it back out.
Okay, yeah. Oh, okay, please don't move. Okay, good girl. There we go, there we go, there we go, there we go.
Brilliant.
Oh, man.
Fingers intact?
Fingers intact, cow's intact.
With the gas removed, the stomach now has to be manipulated back into its correct position.
So what Vic and I have been able to do is to retrieve the abomasum, which was over on the left-hand side where it shouldn't be, pulled it underneath and then up, and now Vicky's busily lassoing it to this right-hand side of the cow. And what that does is means a little bit of scar tissue will form. It'll stick the stomach where it should be on the right-hand side, and hopefully it'll never flip where it shouldn't go again.
So pull that tight. It's nicely
attached to that
attached there.
wall.
So you just need to stitch the skin.
The suturing of a cow is actually really quite difficult because what we're suturing is leather. So it's very thick and very tough to get through. But at the same time, you want to get a nice, pretty result so that the farmer's happy, just like our owners back at Richmond. All right, last one, sweetheart, last one. That's it.
Yeah. All zipped up.
Very nice. Lovely.
Right.
An antibiotic spray completes Athena's treatment.
Great, good job.
Athena is immediately looking so much brighter. She just looks like a different cow already. I was really happy with how Scott and Vicky worked together to get it done. So it went really well. It couldn't have gone any better.
Before Scott leaves, he wants to see how Athena's 6-day-old calf is coping without his mum.
This is Athena's son, Achilles.
Hello, mate. Oh, hello, beautiful. Whilst Mummy was getting surgery, you didn't get your breakfast, did you? Hey, no, you didn't. Here we go. You gonna have some? There you go. There's the good stuff right there. Oh, yummy. Good boy.
It's been a really incredible day today to be able to work alongside Vicky and to help Athena, and now to feed this adorable little youngster. It's been a great end to an absolutely perfect day, and now I can see the benefits of being a farm vet. Pretty nice, really.
Well, they seem to enjoy that, and hopefully Athena will be able to do the job moving forward.
Yeah, she's already looking a lot brighter, so hopefully he'll be back in with her tomorrow morning, hopefully, to just have a little bit of a suck, and then she can go out with the rest of the cows then.
Yeah, unless you want to come home with me, eh? Eh? Yeah.
Today, Alison is heading outside Brisbane to a camel farm, and one of the biggest challenges she's ever faced.
I've just received an SOS from Margie. She's asked me to come urgently to the camel farm. I'm excited to be there again, but a little bit worried, what are we dealing with? Let's do this.
Alison has had limited experience with camels, so helping vet Margie is going to be a massive learning curve.
Margie, it's massive. Humongous. How are we going to get it back in? It's not great. When I arrived, Janet's lying on her side and her entire uterus is actually outside her body on the ground. So it's extremely shocking to see this. Not only is she in pain, she's very weak at this point. Is it still going to be viable? If we can't get this uterus back inside, Janet will die.
So what we've got to do is, I've got to tie some ropes. Hey girls.
As other farm staff arrive to help, Alison and Margie must find a way to reinsert the new mum's prolapsed uterus before it's too late.
We'll tie the front legs because we can't get her to stand up because it'll cause too much trauma if she stands on that uterus. Poor Janet is in such a bad state at the moment. It's the entire bag that the baby has come in has now come outside her body. It's a true life and death emergency. We have to just improvise and make the best of this bad situation.
Close by, Janet's newborn daughter is also struggling to survive without her mum.
So what we've got to do is make a little makeshift operating theatre.
Oh, poor thing.
Hello, sister girl. Hey. No, Bubba. Bubba. Oh. Bubba. Janet is in a huge amount of distress. She's lost a lot of fluid in the birthing process. She's also going into shock, and a lot of her body systems have shut down. Chill, 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 chill.
So a prolapsed uterus is actually where the uterus inverts, almost like a sock turning inside out and coming outside of the body. Janet's calf looks massive, and that probably explains why the labour was quite difficult.
All right, let's get some IV fluids set up. This is something Alison can absolutely nail. If Janet was in the wild giving birth, both animals would definitely be dead within 6 hours. This is a true veterinary emergency. If we don't treat Janet right now, she will 100% die. And if Janet dies, then the calf has no hope. Just watch your foot.
Oh my gosh.
Have you ever heard the term hook a brother up? Okay.
Wow, look at this setup. Margie's really impressing me. She's come up with an ingenious plan to get the bag of IV fluids above her head level so she can slowly infuse those essential fluids into Janet's system. So she gets the farm buggy out, and that's just genius.
I just need her head to stay in this position. You can pop that catheter in, so you go that way. So out here, we've got so many more things to deal with than say if we were in the clinic. I have to improvise, I have to think something up, I have to MacGyver my way through the situation. So I'll just hook this IV up so she's got some IV fluids.
Massive.
Get up through here. So there you can see we've got the fluids running in really quickly. We're going to need to replace at least 10 to 20 litres of fluid over the next hour or so to have any chance for her survival.
With Janet sedated and life-saving fluids now flowing through her veins, Alison and Margie focus on how to get the prolapsed uterus back inside the ailing camel.
So what we're looking at is the inner lining of her uterus, right? Yeah. It looks disastrous, but if we clean it up, it's not ideal, but the body will expel anything dirty.
Yeah.
So that will go in. We are up against time on this one. We've only got a couple of hours to replace Janet's fluids. We've only got another few hours on top of that to actually replace the uterus. Then we've only got a couple of hours to make sure the baby gets what she needs as well. The clock is well and truly ticking. Easy, easy. Oh. That's it. Check that uterus is still in a good place. The case that we have here today is one of the most difficult jobs you have to do as a mixed practice veterinarian. We've literally got 20 or 30 minutes before Janet goes into complete shock. We've probably got 2 hours before we lose Janet entirely. Good job. We're going to put local anaesthetic into the space around her spinal cord and Janet won't feel a thing. It also helps with contractions. We're trying to put this giant organ back in and we don't want her to push it out. This is impossible to do without an epidural.
Uterine prolapse in general is bad. If you imagine a sock being pulled inside out, that's actually the inside of the uterus that we're seeing. So to manipulate that back in is going to be quite tricky.
Yeah. It's about 50 kilos. This bit is and this is twisted.
But after disinfecting the uterus for reinsertion, a new danger threatens the already risky procedure.
Oh, Bobby. So I've just found worst case scenario for Janet. She has a tear in her uterus. If this tear gets any larger, this whole process is for nothing. Janet will absolutely die.
With the tear repaired, everyone is desperately hoping the stitches will hold as the arduous task of reinserting Janet's uterus begins.
Okay, so I've got her uterus resting on my legs.
Not wrong, this is heavy uterus.
Pushing it.
It's about 60 kilos of weight that we have to support and gently manipulate inside. And Margie does warn me that this is going to be a lot of physical work. This is extremely different to small animals that are on the operating table, definitely out of my comfort zone.
We have so many problems to deal with today. One of the biggest is that Janet will get worried, will want to go and feed her calf, and that she'll actually stand up and damage her uterus by actually standing on the uterus. She could rupture the uterus, and that is instant disaster. It's a constantly evolving process. No, baby, no, baby, no, baby. Whoa! That's it, that's okay. Stop straining, Bubba. Easy, easy, easy.
I'm extremely worried for Janet. There is a lot of issues going on. And at this stage, I don't even know we're going to get the uterus back inside.
That's it. It's helpful. It's not all just about getting the uterus back in perfectly and providing her with antibiotics. The problem is that once the uterus is back in, the weight of the uterus can actually rupture the middle uterine artery. If that ruptures, Janet will bleed out within 25 to 30 minutes. Get it! No! Oxytocin! The reason she's straining isn't because she's feeling it, because her calf's here. She's probably feeling everything and nothing all at one time. She knows she's given birth, she knows her calf is alive, she can't get up, she can't attend to the calf, and she doesn't know why. That's it. Okay, good.
Oh yeah, it's going.
Good girl. We're definitely getting there.
Finally, after almost 3 hours of fighting to save Janet,
Yep. Straight.
Margie and Alison complete the life-saving operation.
Good work, team. So we've done well.
It is such a relief when we finally finish operating on Janet.
No, Bobby.
Alison and Margie are exhausted, but now they must turn their attention to Janet's newborn calf.
Hello.
Hey, baby.
Hi.
You are massive.
A very, very big calf, Alison, and I think that's why Mum might have had some struggles.
Like her mum, Janet's newborn daughter is also in a race against time.
We might call her Alison. What do you think?
Allie? Alison?
Alison?
Not so little Allie is actually really gorgeous. She's a beautiful colour, but she's actually in quite a lot of risk. That first milk that a calf takes is very, very important. If Allie hasn't had that first milk, she's at risk of passing away.
It's incredible to think that she was only born 5 hours ago. For our little calf, there's a really small window where that all-important mother's milk is actually able to be absorbed across the stomach lining. This is a really high-risk time for Janet's newborn baby. Here we go.
Hello, Bubba.
So what we'll do is we'll take that up to the lab.
While her mum Janet recovers from her near-fatal surgery, Allie's blood tests will show how much danger her young life is in.
After all the work we have done on Janet, we are going to do absolutely everything we can to help this little baby fight for its life.
Oh, that doesn't look very good, Margie. Do you want to take a look?
Okay, let's see. So we're looking at the number.
The test reveals Allie's protein levels are dangerously low. She urgently needs a life-saving plasma transfusion.
So the first 6 hours of a calf's life are some of the most important in their entire life. That mother needs to stand up and provide that first milk that contains all the immune proteins, all the antibodies. If the calf doesn't get that colostrum in that first 6 to 12 hours, the calf has next to no future. Alison's got the catheter in. I'm just priming this plasma infusion.
So the blood tests indicate that Allie did not get that first milk. If she doesn't get this essential plasma, she may die.
As well as life-saving plasma, Alison gives her namesake milk they've just expressed from her mum, who's too weak to feed her newborn.
Here we go.
Let's just swap that out for her.
That's it. So while Mum's having a break, this is Dr. Alison feeding Alison.
Oh, I'm just being Mum.
So I'm giving Allie a bottle of warm milk, and it's just the best and most rewarding feeling to see her drinking, and it's good to know that she's going to be okay.
You had enough?
Mwah. I'm not going to kiss that now at all.
No.
Slobbery.
Real sticky.
Sticky
Do you
bicky.
want to go up there with the others? Go up with the others.
It's been an extremely tough day, both physically and emotionally, but it's really rewarding to know that we've done some good today, that little Allie is going to continue to thrive, and Janet's going to be a loving mother.
Those legs, they're so long.
All right, and now she's up and raring to go. The circle of life never ceases to amaze me. Bye, Allie.
Bye, Allie.
See you soon. Her calf will be around somewhere. Oh, hello.
A month after their life-saving battle to save Camel's Janet and Allie, Alison and Margie are back to check on the miracle mum and daughter.
See, this one's...
Yeah, this one's actually dripping a little bit of milk here.
Yeah.
It's the end of the birthing season, and while both are doing well, there have been another 12 new arrivals since Allie was born.
I'm extremely excited that Margie has invited me back to witness the beginning of a new camel life.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.